Hi, this is Dr. Nemechek of the Nemechek protocol, and I want to go over why kids recover so much more easily from brain injuries than adults, and why adults need more vagal stimulation treatment than kids do. Okay, so most of my work was based in adults, and now it's being applied to children. All right, and what we understand in adults is that we are designed, when we get a brain injury, to, you get a certain amount of damage. We are designed within a short amount of time, meaning a few weeks to no more than a couple months, to completely repair the damage. All right, and that's how we evolved as a species. Okay, now things can get in the way of that, and the main thing is inflammation can get in the way of that. All right, and so you get an injury. So you have some neurons, my typical little neurons I normally do for you guys. You snap some neurons when you hit your head, slipping and hitting your head on the concrete. Okay, you snap some neurons. If you don't have inflammation, you're designed to rapidly fix that within a couple weeks, completely, and you don't leave any residual damage behind. From a variety of things that are happening, we now have this chronic inflammatory state that when you damage, you don't always fix it, and these neurons go away. All right, now you got a big gap there. All right, we don't have anything that can help us rebuild those, really. After involution, or after the neurons dissipate when they don't get repaired. Now, kids are a little different. Kids get an injury, they fully recover very, very quickly. If they have inflammation, kids get an injury, inflammation, they don't recover like in adults, but once we remove the inflammation, the kids can rebuild them. Okay, and one of the main reasons is these young mammals, and it's not just humans, but other species, make some chemicals that help induce neuroplasticity, and which kind of makes sense because you got this young kind of randomly wired brain to a certain extent, and in its youth it's got to grow. Okay, it's got to fix and wire things depending on what you got to do. We believe the brain gets wired if you speak multiple languages versus if you speak one language, for instance. So they need this ability, and they make these chemicals that do this, and there's maybe a half a dozen kind of candidates that they're looking at. We don't know if it's just one. We don't know if it's a combination. One research group thinks there's also a special cell type involved. So it's fairly complicated what's going on here. But we find as we get older, we lose the ability to make these chemicals. All right? And so that's why kids get damaged. If they have inflammation, they got this. All we got to do is fix the inflammation, that comes back. Adults, all right, get damaged with inflammation, they're like this. They won't come back because they don't make this chemical. Okay. Now, in the adults, a vagus nerve stimulator helps that, and I'm going to get back to that in a minute. But so we have these really interesting studies where you take a mouse, or you take two mice exactly, you take an old one who can't repair itself and a young one, and you graft them together like they're Siamese twins. So you have blood from the young mouse going into the old mouse blood going into the young mouse, and this old mouse has Alzheimer's. And when that old mouse is exposed to young blood, in about a month, the Alzheimer's completely goes away. Okay? And so we see this ability of young blood to actually rejuvenate the brain. There is one case of a gentleman with dementia, a human, obviously, and they did a whole body transfusion with plasma from young adults. Plasma is the fluid in your bloodstream minus the cells, and they put that in them. Huge improvement in the dementia in this individual. So there's a lot of work being done with this. Now, the other factor that prevents adults from recovering too as much is they got a lot more inflammation. Okay, and that's part of what we call inflammaging. I've got other video and blog posts about that. That's where these pro-inflammatory cytokines are increasing over time as we get older, and these things prevent stem cells and different repair molecules and things from working, so that when you damage, you don't fully recover. All right, and so there's this whole big chemical thing. Now, vagus stimulation does two basic things. One is it can control inflammation, and you really only need it 5 minutes a day, 24-hour improvement in your inflammatory control. It's just 5 minutes in a day, all right? The other thing it does is it induces neuroplasticity. So in my adult work, over 7-8 years that we've been successfully getting the brain to recover, what we've realized is that we rarely need the vagus nerve stimulator for people under 35, 40 years of age. Okay, not 100%, but I would say 90% of the patients don't need it. Okay, and this is one of the reasons why in my work with kids with autism and developmental disorders and so forth, where I'm constantly saying they don't need a vagal stimulator, it's because they're making the chemicals that we lose when we're older, okay, that help do that. The kids' chemicals do this. When you're over 35, 40, you can't do it anymore, so you need a vagal stimulator to make that happen. And that's where the adults need to use it for at least about 2 hours a day, in my experience. So that's the differences of kids make these chemicals. That's why they can recover so much easier. That's why they don't need vagal stimulation. As the older we get, we make more inflammation. We also lose the ability to make these rejuvenating chemicals, and so we have to add in the vagal stimulator in the adult patients. So that's all for today. This is Dr. Patrick Nemechek, Buckeye, Arizona, of Nemechek Autonomic Medicine. Have a good one. Bye.